Good morning. Good morning from the London PPN. It's a slightly frosty Friday morning here, and I'm hoping that I'm just wanting to extend a very warm welcome to everybody who joins today. Hopefully, helping us to celebrate the birthday of the London Psychological Professions Network. So I'm going to be with you all day. I'm very delighted about that. My name is Estelle Moore. I am a clinical and forensic psychologist. I've been working in the NHS for over a quarter of a century, and I'm really pleased to be the chair of the London Psychological Professions Network. I am representing a whole team, and you can see some of those names here. I'm just going to introduce those our colleagues to you. Really grateful for all their support and assistance over this first year of the London PPN's existence. We have Amrit Chima, who's working behind the scenes today as program manager, helping us with to make sure that your voice, if you've joined this morning, is heard. And we have our experts by experience who've been working with us all year. Pod Young, who you'll hear from later, Natalie Mark, who's not able to be here today, but is a wonderful representative of the voice of young people, and Caroline Jeffs, who represents the voice of carers. We've had support from Howard Fucher, who's helped us remember the role of the peer support workers, and Mariam Halawi, who's a senior assistant who's moved on now, but is drawing on other skills and staying in the work of psychological professions, and we will welcome Julio Patalio to that role shortly. So a very warm welcome on a cold and frosty morning to this session. Behind the scenes we have, I'm going to say from time to time, I'll say next slide please, Matt, because we're also supported today by First Sight Media. So I'll just move to the housekeeping slide and explain a little bit about that. So the welcome is warm. We'd love to hear from you as we talk today. Please feel free to post your ideas or comments, any questions into the Slido window, which will be available to you. And I'll come back in a minute shortly to our invitation to you in relation to Slido. If you have any technical issues, and I know that there's been one or two sort of logging on, sometimes people's browsers don't allow them to open a new link, but please do feel free to email webcasting@firstsightmedia.co.uk if something is occurring that is you'd like some assistance with. They were working with us behind the scenes. Just want to say a quick note that the sessions are being recorded. This session will be recorded for future review. So if you don't want your name to appear in any postings, please do so anonymously. It's very helpful. We found in the London, in the conference week in November last year, the Psychological Professions Network conference, it's very helpful to hear from people, and we're working through some of the feedback and really great ideas that people shared in that event. So it seems a really good way of promoting engagement, so thank you. Really hope you enjoy the morning. Dip in and out as you require and get coffee and just enjoy the ride, I hope. So on the next slide, I think we have a plan of the morning. So as I'm just doing some introductions, what I'm going to talk about next is I suppose a whistle-stop tour looking back at 2021 in London and for London, what we've achieved and what next. To set the stage for the morning. And then we're really looking forward to hearing an update from PPN England and an exciting introduction to the workforce plan from Adrian Whittington and Geeta Bhutani, who I'll introduce a bit later. We're going to describe the work of the PPN, the London PPN's Workforce Council, and we're really delighted to be joined by Health Education England, some colleagues, our colleagues Leo and Natalie, and Professor Helen Pote, representing the higher education institutions for London. Our experts by experience pod will tell us about his journey with us, and also a really good example of some of the work in London with aspiring psychology from our colleague Simon Draycott. We then have the pleasure of being joined by Professor Peter Fonagy. Needs no introduction. We'll come back to that. And a short screen break, and we'll be thinking then about some of the embedding of some of the key principles of trauma-informed care across the capital. Thinking about the Women and Girls Network with Ebony Wilson, and talking about mental health settings, safety in mental health settings with Tim Bryson and Shirley McNicholas. And rounding off the morning, we have a team who have been working tirelessly on taking care of the staff since the commencement of the pandemic. So that we're looking forward to hopefully just thinking about everybody in this in terms of workforce. So at the very end, we'll come back to some of your reflections on this. So I hope I hope there's something in there for everybody. If I move on to just thinking about what are we doing with a psychological profession network, primary objective. I'm sorry that those planets underneath are slightly fuzzy. I don't know if you can. I will talk a little bit more about our the mission and goal and how they've been co-produced in a really lovely and engaging way over the recently. Just that planet putting people first, and if you can see it on the left, is absolutely the primary objective. How can we work together as psychological professionals to improve people's lives by extending evidence-based psychological practice right across the whole of healthcare? We're wanting to make health and care psychological, all of it, and unite and increase diversity in the psychological professions. There is another planet missing here, but these four we'll come back to how, and you'll be able to see some of the operationalization of these principles as we move forward. On the next slide, thank you. There'll be some key messages that I hope that we can get across too, that the vision for the Psychological Professions Network right up and down the country is to deliver the long-term plan. The long-term plan there, the document on the left. If you want to access any of these documents, please do go to the PPN England website. You can click onto these and access them. So emboldening the forums for unifying psychological professional leadership across the 12 psychological professions is necessary to deliver the long-term plan in order to improve public access to and knowledge about psychological services and the experience of our services. For anyone who is arriving to this to a network of this kind for the first time, there are some really helpful animations that describe the 12 psychological professions that we are representing. So the group of psychologists, it's a little tiny picture there, the group of practitioners, psychologists, and colleagues who are working in counselling, psychotherapy, and those groupings. So there's if you're wanting to brush up on that, there is a video on the website that will explain all of those roles. But those roles and others that what we need in order to deliver the long-term plan is a whole heap of cooperation and collaboration because we can't do it on our own. The coordination of the PPN mission statement with other professional groups and stakeholders, including allied health professions, arts therapy colleagues and medical psychotherapists, all of which make a huge difference to the patient experience. So the long-term plan requires us to generate and fill 10,500 new posts by 2024. So there's the challenge. So that key message will be coming back, flowing through this morning's workshop. On the next slide, just to sort of getting the context for the what's driving the need for this expansion. So a 60% increase in the numbers of psychological professionals over and above 2019 estimates, because on top of this, the pandemic over the last couple of years has underlined the practical importance of meeting the aims in the plan, but also has highlighted increased further need for psychological services. So we've got a sort of double whammy. And as we'll see through some of our looking back over 2021, also highlighting population and workforce inequities, which we carry with us, carry forward from existing services. How do we work with those issues to even things out and improve access for all in a fair way? So there will be a number of impacts of the impacts on the existing professions as they are in terms of to deliver the expansion, which will include training. We might be considering all sorts of ways we will be considering all sorts of ways of enhancing training. Also supervision, the infrastructure, and leadership are required to be able to host this expansion. And of course, there will be a number of barriers, and some of those things we will be considering today. Even a barrier such as, well, who are the psychological professions, and particularly importantly, who's going to be representing them in workforce planning. So these are some of the I'm just bringing these ideas to you as we start the morning, because they'll be woven into some of the presentations later. We have, thanks, next slide. We have the support of Health Education England, which is so important. Just thinking this slide dates back to a year, we're already into 2022, but the years gone, previous years, and some of the key themes that the funding initiatives were designed to support. So we have clinical psychology, in terms of clinical psychology, increasing the diversity, quality, diversity and inclusion initiatives around leadership and mentoring and paid work experience opportunities, which we'll hear a little bit more about because they've been operating this year. And similarly, in child and adolescent psychotherapy, some similar themes to alter the workforce profile so that it is more diverse and inclusive. And there's certainly been funding into the family and systemic psychotherapy group to bring more training places to expand these key roles in CAMS and other services. And finally, leadership. So mentoring for aspiring psychological professions leaders on the horizon. So we're grateful for that support, and we'll hear more from Health Education England a little bit later in the morning. And just a very, very quick mention to the next slide, thanks Matt, which is relates to the workforce plan. So we haven't had a workforce plan before for the psychological professions. So I'm not going to spoil it, but I think leave the introduction of that to Adrian Whittington. But just to highlight that we are seeking to grow, develop, diversify, lead and transform, and that is extremely exciting. So I'm just moving to the part which involves hopefully your thoughts. So on the next slide, our invitation to you is to share your ideas. We hope that throughout the morning that you might just pass comment on or share your reflections. You might want to join the word cloud and add your thoughts to what, in your experience, some of the current or possibly future barriers to successful delivery of the long-term plan expansion agenda, what you think those will be, or they may be already very much in your horizon if you're either leading a service or experiencing a service or planning to train people to deliver the service. So anything on barriers would be very helpful to hear about. But also, given it's a celebration of the year, we'd really like to hear what you think has gone well, or in your experience, something you feel really proud of in relation to the implementation of long-term plan initiatives, or anything in relation to the psychological professions workforce in this region. That would be wonderful to hear about. If neither of those clouds feel something that you want to contribute to, and if something else is burning on your mind and you really need an answer, please do feel free to ask questions and raise those questions in the chat, so that we can come back to them as a focus for London. So thank you very much for that. So we'll send you some reminders to contribute as the morning goes on. Okay, I'm going to do a very, very quick whistle-stop tour through looking back at London in 2021. So, as people living in the capital, just some of the things that have occurred. Way back in last January was a record high of daily positive test figures at the beginning of the month, and the London Mayor Sadiq Khan declared that the virus was out of control in the capital at the beginning of last year. And we went into a third national lockdown. What you can see here is an amazing wall. It's a national memorial wall on Barts Hospital. Of each of those hearts is a heart drawn by somebody who's lost a loved one, in memory of their lost loved one. I think so just the context for the year is obviously dominated by the pandemic. So next slide, thank you, Matt. And some of those stories. So whilst the vaccination program gets underway, there's some amazing characters that inspired us. Just you may remember Sir Thomas More, who died in this year at the age of 100 after walking to inspire the rest of us to keep going. And we learned a lot about the impact and value of the vaccination program, reducing the need for hospitalisation for older adults, particularly by more than 80% in the very early spring of last year. Just a quick note that there was a proposal, it's lost in the rest of the politics, to give NHS workers a 1% pay rise, described by the government as that's what's affordable given public figures. And I'm not going to go any more political than that, but just to keep moving on to the next slide. And think about just, I suppose, some of the other the impacts of the pandemic for all, the losses that it brought. As a very poignant picture of the Queen sitting on her own there as at the loss of Prince Philip, Duke of Edinburgh, in that year. And but despite that, the number of daily deaths from COVID was beginning to fall by the middle of last year. And then, of course, with the rise and fall, the arrival of the Delta variant in the middle of the year. Just also a note there around some of the racial issues that influencing our thinking and experience. Just a note that in April last year, the police officer Derek Chauvin was convicted of the murder of George Floyd, and some of the just thinking about the racial injustice that has come to the fore so prevalently, and how we've responded to that in across the capital in terms of also in psychological professions. So on the next slide, I think some of that, some of those tensions erupting in the summer when we saw Wembley Stadium, difficult scenes at Wembley Stadium, racial abuse online sadly following the game. And the next slide, thanks, Matt. Another key feature of that we'd be thinking about in terms of action, London's Climate Action Week, held despite the challenge posed by the pandemic in the summer, in preparation for later work up in the on climate change across the country, and many countries joining. So I'm just thinking towards the end of the year, thank you, next slide, into the autumn phase. Black History Month was celebrating, particularly in the NHS, the stories from colleagues from all different backgrounds, particularly celebrating the contribution of those colleagues to the NHS. And we lost two really significant psychological figures last year. Dr. Aram, and known to his friends and family as Tim Beck, was the founder of cognitive therapy, died at the age of 100 last year. And I just also Professor Sir Michael Rutter, who's sometimes been referred to as the father of child psychiatry, died at home in October, surrounded by family. Made a huge contribution, just thinking about both of these figures, to both psychiatrists, in fact, but making pioneering changes to how we understand child development and the relationship of thoughts to behaviour, and so such significant contributions. On the next slide, I think we're nearly towards the end of the year. Just thinking, yes, looking back with concern. So something, obviously, I've avoided a number of other rather more negative elements for living in capital life, but living life in the capital. But just to highlight this one particularly, looking back with concern, 2021 was the worst year ever for London teenage homicide victims. There were 30 teenagers died in the capital, passing a previous peak of 29 in 2008. The youngest victims were aged from 14, and this is a picture of Hawa, the mother of Tamin, who is standing here at a vigil for her son, who she lost in the Woolwich area. So I'm just to try and give you a flavour. On the next slide, just coming into our to thinking about what can we learn in terms of our vision for the psychological professions from these headlines, how much we need to be responsive, to be adaptable, patient-centred, trauma-informed, thinking about how what we do is sustainable, acknowledging of intersectionality. We also need innovative responses to the expansion agenda that are flexible, resilient, evidence-based and outcome-oriented. So there is a challenge, and here are the planets in action as we set off on that journey. So the next slide, I think, is just a whistle-stop introduction to London as a region. So London is the sixth of seven regions of the PPN to get established. It's comprising, as a population, London comprises almost 9 million people in the general population, and 217,571 staff members working in the NHS workforce. That's a head count that was taken in January. So one of the my difficulties with this slide is that the numbers don't always add up. So as a psychologist, it makes me fret. But there are 5 integrated care systems across the London region. If you look to the right of this slide, or to my right, but there's the turquoise region, that's London. So it's geographically small compared to other regions, looking up at the north there, but very concentrated in terms of what's happening in the region. So there are 32 boroughs, 18 acute trusts, 4 major trauma centres, 10 mental health trusts across the 5 ICSs, integrated care systems for London. So there's it's a busy and active place. To the next slide, just say a little bit more about those regions. So yes, so the total head count across all of these trusts in January being 217,000 and a half staff. So on the next slide, just a little bit about what that means in terms of the strategic direction for London. So prior to the pandemic, the King's Fund was a wonderful work of the King's Fund. So I highly recommend Googling King's Fund materials that describe London as an emerging ecosystem that covers this very diverse population. On the right, there is a map of the diversity that is represented in the population, but also highlights pre-pandemic a number of health inequalities and the need for more community rather than hospital-based care. So this is the direction of travel strategically before we went into the pandemic. And slightly, if we can, move in the direction of less reliance on fewer specialist hospitals, but the need to encourage the development of academic health and science centres. So this was pre-pandemic, and just on the next slide, just to get the sort of context and landscape. Providing that care over that region, then we have 134 NHS hospitals, a whole range of clinics in addition, 32 acute hospitals and National Health Service trusts, and 37 non-acute in the Greater London area. And I don't know where to start in terms of just how to highlight some of those, but obviously there are some majorly excellent healthcare providers amongst all of that. So Barts Health being the largest NHS trust in London, with over 16,000 staff and seeing more than 900 patients a day in A&E. Somewhere like St George's, the largest of the city's hospitals, one of the few hospitals to have recorded lower than expected mortality rates every year since records began. So it's a very good hospital, but despite having the serious and complex cases for London. And then, of course, there's a range of mental health services in the capital, South London and Maudsley, for example, providing one of the very widest range of NHS mental health services in the UK. And I could go on ad nauseum. 4 major trauma centres. So what I suppose I wanted to highlight was how do we work together? What's been the impact of the pandemic for the London region? On the next slide, thanks, Matt. It's post-pandemic London, informed by the NHS People Plan for our staff. Really trying to make sure that we have a shared purpose and permission to act over those boundaries together. Belonging in the NHS means also tackling discrimination and some of those, addressing some of those inequities that we heard about just a moment ago. Flexible and remote working has been introduced post-pandemic, and always searching for new ways to work and deliver care. Really key is how we're going to grow for the future and recruit and retain excellent staff. So post-pandemic London, working to some of those strategic priorities. And on the next slide, I think just a very, very quick word about what a psychological professions network is aiming to do. It's supporting over the whole of the country. The networks support the regional delivery of the vision for England, and that's set out in a number of papers. Again, refer you to the website, but across a range of work streams and projects, really aiming to deliver maximum benefit of the psychological professions for the public. So a PPN is really a free membership network for all those psychological practitioners in NHS services, those that are in universities and training to become psychological practitioners, and associated stakeholders. One of our tasks is to make sure that we're providing workshops and events just like this one, linked to a strategic NHS agenda, and communicating with members about new and relevant issues, supporting workforce planning, development and commissioning. So some key strategic aims to inform all the strategic stakeholders, to enable engagement and to influence policy. So this is the role of the PPN. On the next slide, I think we move to, coming back to the workforce plan. So I'm going to invite at this point Dr. Adrian Whittington, who is the co-chair, he'll tell you himself, but is the co-chair of PPN England, to tell us about the exciting news about the workforce plan.
Hi there, I'm Adrian Whittington. I'm National Lead for Psychological Professions, and I work across NHS England and Health Education England. And I'm also co-chair of the Psychological Professions Network for England with Geeta. And it's a delight to be here at the event today to say happy birthday to PPN London. It's a great achievement to have really sort of put yourselves on the map during the year. And it's been great to be hearing about everything that you've been working on. I wanted to set the scene for your workshop today by introducing the Psychological Professions Workforce Plan for England, which is a very exciting moment, actually, to be able to launch this. It's been rather a long time in the making. It's a plan that sets out our sort of ambition for the psychological professions workforce in England for the period up until 2024. So we've never had one of these before. It's really designed to support the system to maximise the benefit of the psychological professions workforce for the public. So why have we done it? Partly because the growth required for the psychological professions is so large that a specific workforce plan for the psychological professions is warranted. And partly because, of course, we know that our 12 plus groups are really quite poorly understood across the system. So the plan helps us in terms of facilitating those conversations about what these groups are and how they can be used to best effect. And we hope that this plan will end up in the hands of all of the different players across the system to facilitate the required change to bring these professions and groups to the fore and make the best use of them for the public. So there's 5 key elements to the plan, 5 themes. The first of these is grow. So we need to expand this workforce by an unprecedented rate over the coming years. Approximately 60% growth required from 2019 to 2024 in these groups. So this is massive, very ambitious. And that represents about 1/3 of the total mental health workforce growth required over that period. Of course, recognizing that there's also a need for growth in these groups outside of mental health and beyond mental health. Second theme is to develop. And what this means is the development of these professions through a sort of more integrated and rational career framework and progression opportunities. Diversify is the third theme. This is for us to make the best use of all of the talents across all of the protected characteristics coming into these professions. The fourth theme is to lead. This is getting the right leadership in place at local, regional, and national level to support this whole agenda. And the final theme is to transform, which is all about new ways of working and making best use of new roles. So in the plan, we've set out actions that could be taken by all of the different players in the system, the arm's length bodies, so NHS England and Health Education England, obviously soon to be a single body, integrated care systems, employers, higher education institutes. And to facilitate this change, we think all of these groups are going to need to work together really in quite a radical new sort of partnership. If we look at what all of this means for London, then London represents about 19% of the weighted population for England, which means that of the 10,500 new posts in the psychological professions that are needed across England, about 2,011 of those would be required in London, according to the modelling. So bearing in mind this need to work across the system to achieve this really quite sort of significant and rapid growth, and all of those sort of enabling elements that I've described and that are listed in the plan, I think there's a really key role for the Psychological Professions Network. And that, I think, is to be the glue. So it's to, by working together through the network, be the glue that helps all of these helpful conversations to happen across the system to deliver this. It's only by working together we're going to be able to deliver it. And I think the PPN and you, us as the PPNs, can really help to support that work for the benefits of the public. So I wish you well with the remainder of your workshop today, and with that endeavour to achieve this really ambitious collective push. Thank you very much.
Brilliant, wonderful. Thank you so much, Adrian, for getting us off on that start and the challenge. So just a reference then to the workforce plan, and there is a blog about that workforce plan on the website. And the next up, an introduction to Dr. Geeta Bhutani, who then I think will introduce herself, but we'll talk a little bit more about training and new roles and the framework that will enable the expansion to happen. Over to Geeta.
Hello, it's lovely to be here. So I'm Geeta Bhutani. My current sort of role is the co-chair of PPN England and also the co-chair of the psychological professions in the Northwest. And I also support Health Education England with PPN development and some workforce projects. So I'm delighted to be here at the London PPN's first birthday. It's so fantastic that there are now 7 PPNs across the regions, and London is one of them, and probably one of the largest in terms of workforce. So Estelle asked me to talk a little bit about the new roles in the workforce and a little bit about career maps and career frameworks. So I'll try and cover that off fairly quickly, but it's probably going to be pretty swift. So we'll see how we go. So, I mean, I think there's been some new roles over the last few years, you know, including the children's wellbeing practitioners, the emotional mental health practitioners, and there's also some emerging roles from, you know, regional developments such as the clinical associates in psychology and the associate psychological practitioners. But what's particularly off the press at the moment is the mental health and wellbeing practitioners, which is a new role, which is going to be working within, I think, probably most of the community mental health teams, but people with significant and complex mental health problems. And their role is going to be to support people with psychological interventions and personalised care planning. It's part of the community mental health transformation, and there's going to be courses starting in March across all the regions, and the role is open to people with or without degrees at different levels, and they'll spend most of the time in the workplace, but a day a week at university learning more about the psychological interventions that they're going to offer. And after a year, they become qualified and they move up to a band 5 career grade within the NHS. So that's an exciting new opportunity to really improve psychological interventions within community mental health teams. The other new role is the Youth Intensive Psychological Practitioner, which is a pilot project over the next 2 years. And it's going to be for people who come from a psychology degree background, who go on to train in a postgraduate certificate to support young people with complex difficulties who are either in inpatients or in intensive community settings. And it's particularly people that perhaps got a range of problems, whether it's eating disorders or risk issues. And their role is very much to support qualified, predominantly clinical psychologists to improve therapy, treatment, and intervention in that population. The training model is very similar. Again, largely work-based training, but you also spend a day a week in university learning a bit more theoretical knowledge. So it's a really exciting time, I think, to be within the psychological professions family. I mean, as you know, we've currently got around 12 in our overall family at the moment, and I can only see the number actually growing over the next few years. But one of the ways, just to remind perhaps some of the audience, and others may be familiar with it, is don't forget the Psychological Professions Career Map. So the Psychological Professions Network England website, so the PPNE website, has a link to the Psychological Professions Career Map. And there's a lot more information on there about the different roles within our family, what the entry criteria are, and also what they do. And we update that regularly. And, you know, soon some of these new roles will be able to join us, you know, when we get to a national rollout. But it's pretty a confusing landscape. You know, we've got psychological practitioners, we've got practitioner psychologists, we've got psychological therapists, we've got counsellors, so we've got wellbeing practitioners. And I think what's becoming really, really obvious is how we actually make some sense of it. Because currently the entry points to most of our different professions are very varied. There's very limited transferability between our professions, and there's limited career development for some of our professional groups. So what we're starting to look at is how can we make this a bit more streamlined? And how can we provide opportunities for people who come in, say, at the wellbeing practitioner level, to go on to whether it's psychological therapy training or to other development within the NHS, so that they can have a long-term career and learn new things and just continue to make a difference. So some of the things we're looking at is, as I said, entry points, transferability, leadership development, and also we need to think about accreditation and registration, because that's been a challenge for our groups as well. So more on that at another time, because I've only really got 5 minutes to talk to you today. So it's just a brief introduction, but I hope the rest of PPN London morning goes really, really well, and look forward to being a part of it. Thank you.
Wonderful, thank you, Geeta. So much to think about there. Usually there's an explosion of questions in relation to the new roles work, because there's and they're very helpful. It's very helpful to have those questions to help everybody to think through as Gita says, the complex landscape. I'm going to move on. I'm going to move us on. If we could move to the next slide, thanks, Matt. To just think about London's what has happened over the last year in the London PPN, and hearing a little bit from the workforce team, and that what a workforce council is all about. So in this last year, we've had a lot of stakeholder engagement. We've had pop-up sessions to support and increase membership across London. Wonderful support from other regional networks. I'm just highlighting one here, the DCP, the Division of Clinical Psychology in London, the Dr. Lorna Farquharson, who's a part of the team and supported us to get embedded and share learning. We've had lots of engagement in relation to the Chief Psychological Professions Officers across the capital, attending webinars and sharing information from the PPN England, all sorts of topics, leadership, whether or not we need a CPPO on every board, Children and Young People's Workforce Census, and we're going to hear more about that shortly from Professor Peter Fonagy. How might we implement routine outcome measures in adult community services, DBT training, the list is long. So we've got, there's a lot to do in terms of sharing information. The Workforce Council, I'm just going to show you a little bit of an example of how that works as a hub and spoke leadership model, and it's set up and established. We have representation in London from IAP services, widening access expertise, child psychotherapy, systemic family therapy, early intervention, older adults. I think it's not listed here. Clinical health psychology too, perinatal and forensic services. So very grateful to leaders across London supporting us with their advice and guidance. And this is on the next slide, just sort of illustrates a little bit how that works. It looks a bit of a busy slide. I think we were planning to make it slightly less busy, but a council seat, a circle in the middle circle, those dots would be a council seat from one of those representatives who would be feeding back information to their local community via task and finish projects or any other stakeholder engagement, so that the work of the PPN is distributed in that way. And I think that's quite exciting when you start to think about how many conversations buzzing up and down the region that would involve. And so coming forward then to thinking about hearing from different influences and perspectives on our council, I'm going to turn at the start to one of our experts by experience. We've had 4 guiding us, as I mentioned earlier. I'm going to hear from Pod Young about his work with the council. Thanks, Matt.
So I've been working with the PPN for about a year now, and my role is expert by experience sort of / advisor. I've been helping with sort of council meetings and trying to get projects off the ground, and yeah, I really like working with the PPN. I do a lot of expert by experience work with other trusts and organisations. I was recommended to the PPN by a senior psychologist. I really feel valued with the London PPN because I have experience of services, and I'm used to the dynamic being very different between sort of person and psychologist, but now it's kind of colleagues. I feel very valued. I'm always asked to give my input on things, which I try and take up as much as possible. But overall, my experience with the PPN has been very positive. So we've got a project on trauma-informed care, which was decided by the expert by experiences on the London PPN. So it was really good that we suggested a project and it's been taken up very seriously. I'd like to see, our paper out there. I'd like to see more interaction with services and like to create equal partnerships with services and psychologists all around London to try and put an influence on what's happening in the London area. I'd like to see my role develop with having more of an influence on services and being more involved with the rollout of trauma-informed care. Like I said, I feel very valued as an expert by experience for the London PPN, and I would like that influence to expand and, to create relationships with other trusts and be a bit more active, and hopefully my name gets out there as someone who would get things done. That's my aim with the London PPN, is to get things done and roll out trauma-informed care. Our experiences can help shape services for people of the future. I mean, the potential for trauma-informed care around London, we might not see, all the benefits in our lifetime, but to start it off and to get it rolling and helping people is, that's my influence on the London PPN as an expert by experience. So yeah, it's hugely valued by the London PPN, and I'm really happy to be working with them.
Thank you, Pod. So a bit helpful, very, very helpful to hear about that work, and we're going to come back to trauma-informed care shortly. We've got the next contributors are from Health Education England. So we're really importantly funding PPN initiatives, but also funding training across the capital. We're hearing from Leo and Natalie.
Hello, my name is Natalie Moyana, and I'm an Associate Workforce Transformation Lead in the Mental Health, Learning Disabilities and Autism team at HEE. Our team covers a variety of programs from cradle to grave. So these are perinatal mental health and CYP, homelessness and problem gambling, all the way up to older adults and healthy aging. I'm going to hand over to my colleague Leo.
Hi everyone, I'm Leo Murta. I'm the other Associate Workforce Transformation Lead within Health Education England London's Mental Health, Learning Disabilities and Autism team. We're here today, as Natalie said, to talk about the ways we've supported the PPN and psychological professions colleagues over the last year. I've worked very closely with the PPN, as has my predecessor, Jess Partington, who some of you may know. We funded a number of programs, including training for family and systemic psychotherapy, the RISE Leadership Mentoring Program, which is aimed at improving the working experience for BAME colleagues in the NHS. And we've also funded a number of paid work experience places for those considering a job in the psychological professions to improve accessibility. Additionally, we've funded around 300 places on various psychological therapies for serious mental health problem courses, including CBT for serious mental health problems, DBT, mentalization-based therapy, and a number of others. And we're also supporting the launch of the new mental health wellbeing practitioner role. All of these we'll be supporting again next year and expanding as much as we possibly can. I'll hand back over to Natalie to describe some of the other areas we've been supporting.
Thank you, Leo. So some of the specific areas and programs that I look after are around the peer support workers, our PSWs. So I have enabled peers to be trained within trusts as well as in voluntary sector organisations, our VCSOs, to make sure that they link in well and that they can work together both for our inpatient and our community patients coming out as well. We have funded 184 placements so far for the peer support worker training, and that's counting. And then another aspect that I look after is the approved mental health professionals, the AMP role. So I link in with the AMP leads for the trusts and really try to see how HE could support the AMPs going forward. Another aspect is the approved clinicians. So again, we have linked in with our HEI organisations, and we have some training that is upcoming from March onward for this financial year for our approved clinicians. One of the other things that we also kind of oversee and that I am very much kept aware of is the apprenticeship. So we support the apprenticeships such as the Clinical Associate Psychology, so the CAP apprenticeship, as well as the Medical apprenticeship, which is currently ongoing and in discussions with the Trailblazer Group, along with our nursing apprenticeships and our TNAs, our Training Nurse Associates. These are just some of the things that really kind of link into the things that you'll be talking about throughout today. So aspects around career progression, aspects around diversity in professions, thinking about CYP, thinking about the community as well. And so really our team are here to support both the PPN and the wider NHS and clinical workforce. Leo?
Everything we've described today will continue to keep the PPN informed about, and including and excluding the things we're working with them on in particular. So please stay linked in with the PPN to know about what HE is doing in the year ahead. Thanks very much.
Thank you.
Oh, thank you so much, Leo and Natalie. One of the great aspects of this last year has been developing those relationships so that we maintain a dialogue. I think that dialogue, particularly when funding's on the agenda, coming and going, and maybe changing in terms of its the size of the pot, it makes such a difference to have that connection. And thank you very much, Natalie, for highlighting some of those roles, particularly like the clinical associate psychologist, which we're going to celebrate shortly. But firstly, to hear from another Workforce Council member, Professor Helen Pote, who represents the higher education institutions for us. So over to Helen. Thank you.
Hello, I'm Professor Helen Pote. I'm a clinical psychologist, have been for the last 25 or so years. And I'm clinical director of one of the largest clinical psychology programs in the UK. We train clinical psychologists for the NHS. I'm really delighted to be a member of the London Psychological Professions Network Workforce Council. I'm the academic partner on the committee, and that means I'm representing training and higher education and the development of our professions more generally in terms of our skills development and competencies. I guess I've worked in training of psychological professions, not just clinical psychologists, for over 20 years. And that's really given me some impetus to think about why joining together as psychological professions could really benefit us all in terms of our development and in terms of the services we offer to clients. If we think about the first value of the NHS Constitution, it's working together for patients. Patients come first in everything we do. And when I interview new clinical psychologists, new psychological wellbeing practitioners and other psychological workers, the thing that they tell me is that they're in it for the benefit of clients. They want to help people improve their lives. And that's why what motivates most of us on a day-to-day basis is seeing people grow and develop and deal with their psychological difficulties. And how can the PPN help us do this more effectively? I've been thinking about this, and there are three things that spring to mind, and why I'm interested in getting involved really in the Psychological Professions Network. The first thing, I guess, is that it helps us work together more effectively as a team. Working together through the PPN helps us understand a range of psychological professions, their strengths, priorities, communication. It improves our communication with each other. And when we look at when services go wrong, when there are critical incidents, when patients aren't getting the best care, that knowledge, that communication is often key at what's underpinned some of the difficulties in services. So improving that teamwork can only be a good thing. Secondly, I think it will help us improve our psychological models and interventions more effectively. In training, we often talk about evidence-based practice, developing the outcomes literature and using that in our interventions to make sure clients are getting the best possible service. But we need to move beyond competition between different models and different professions in the way we develop outcome studies to look at the active ingredients across professions and think about how this can improve patient care. How can we find what is actively working for clients and deliver it to them? And finally, I think that working together in the Psychological Professions Network gives us a stronger political voice to advocate for patient needs, as well as develop our workforce. I think there really is power in the union, that the PPN brings us together, and it's the improvement in patient lives that will drive that. So I'm passionate in us coming together and seeing what we can do to not only develop our workforce, but to have a political voice and improve the lives of clients.
Brilliant. Thank you so much, Helen. And just as an example of that passion in action, the new roles in London that we might want to celebrate from last year, particularly clinical associate psychologists, been a significant growth in the capital in these roles. And you can see on the right here, slightly fuzzy, but nonetheless enthusiastic and really pleased about the work that they're doing. They're holding up something about what they've enjoyed about being a CAP in this last year, the UCL cohort. So they've been hugely important in supporting community mental health transformation programs across the capital in these apprenticeship roles, and employers in the capital really seeing the potential of CAPS to the workforce challenge. Additionally, I think Helen didn't mention it, but the CAPS roles in CAM services that she's been particularly involved in. And coming to the last of our celebratory initiatives, the last one, the next slide, thanks Matt, thinking about aspiring clinical psychology. So we may way back at the beginning we were talking about the HEE funded initiatives. This one is one that's been run again across the capital successfully, including a number of trusts, and overall the scheme supported or provided more than 45 opportunities in London. And here to tell us about it is Dr. Simon Draycott, who's been particularly who's led from the west of London on this initiative. Thanks to Simon.
I'm Simon Draycott. I'm a consultant clinical psychologist at West London NHS Trust. And I'm just going to talk a little bit about the programme for aspiring clinical psychologists, which has been an active pursuit across several trusts in London, including ours. And I've been leading for West London in that process. So to give a bit of background about what this programme is and why it exists, we've known for many years that specifically in relation to clinical psychology amongst the psychological professions, there is an inequality in terms of ethnicity and in terms of people from less well-off, less privileged backgrounds being able to achieve qualification as a clinical psychologist. And we know there's several points at which the pathway towards qualification throws up obstacles which make it more difficult for people from those backgrounds and indeed people who have caring responsibilities to get qualified. And one of those is increasingly that in order to build up the work experience that's needed to get onto a training program, people have had to be picking up voluntary work. And that immediately creates an obstacle for people who can't afford to donate their time for free. So this program is funded by Health Education England, and it's an attempt to try to create a way into building up that work experience as a first step towards being able to get onto a training program, specifically aiming to support people from BAME backgrounds, people from less privileged backgrounds, and people with caring responsibilities. But doing that in a way which isn't something which is imbalanced in terms of things like the Equalities Act. It creates a route, not an exclusivity. So the HEE put out a call for bids to take them some money to be able to create relatively short, so 3 to 6 month work experience placements, paid placements for aspiring clinical psychologists. And often this is referred to as the Aspire program. Within West London, we refer to this as a Catalyst program. That's our own personal branding. So multiple trusts across the London region put in bids for varying numbers of these placements and were successful. And I believe in the region of 40 to 50 places were created in London. And we then had to do quite a lot of learning quite quickly. One of the things we did was we tried to work in partnership with each other across London as much as we could to try to learn from each other, to try to make sure we were sharing best practice and supporting each other in trying to make some important changes in the way we tried to recruit people. The learning we had to do was based a lot around how to try to remove opportunities for bias to creep into the selection process. And that involved doing a lot of learning about things like competency-based recruitment, a lot of learning which has been led for us by the University of Lancaster doctorate and clinical psychology team, thinking about how we would go through the recruitment process, how we'd reach out to the right kinds of candidates, how we would try to ensure that we had a clear set of very well-defined competencies we were looking for, and multiple ways of trying to assess those so that we made sure that there was a fully level playing field for all candidates. And we've been, I think, successful in recruiting a group of people to these posts, which is much more representative of the populations in which we as trusts are based and the populations that we need to serve. And we work together within that now to try to think about how we could try to support these assistant psychologists, because they're all banded as band 4 assistant psychologists, in terms of the training that they're provided to try to set them up so that they have a good chance of being able to get a substantive post at the end of these work experience placements. So we're sharing ideas around training, as we've shared ideas around recruitment. We are guiding people around becoming a reflective practitioner and a scientist practitioner. And now we're thinking about how we'll go about trying to evaluate this program together, linking up with our colleagues from higher education institutions to think about how to assess the effectiveness and the value of this. We are already sure that we've managed to select a group of candidates, which will, is as we say, more representative of the populations we're trying to serve. And now the next challenge is how to try to bend this down as a process that we can replicate. So Health Education England has done another round of funding and another set of bids with the intent of spreading this more widely. And one of the challenges now will be how to try to embed this kind of opportunity within the trusts across London to try to make sure we create these pathways and remove those obstacles that otherwise get in the way of people from the backgrounds that I referred to being able to get onto training programs. So down the line, we as a profession, as a clinical psychology profession in particular, can be more representative of the populations that we have the responsibility of trying to support.
Thank you very much, Simon. Thank you to everybody who's represented their work in the Workforce Council. It's a huge amount of activity ongoing. And so that absolutely, I'm imagining that there may be some questions. And so I'm just a reminder, do please type anything you want to into the Slido as we go forward, because there's a whole heap of work to be done and we don't have answers to everything. So we do need your engagement and support.